My name is Lindsay Morris, and I'm a Director of Operations at CHAS Health. I do think the clinical experience that I had when I earlier in my career was really helpful to where I am today. A lot of the staff that I work with I worked with on the floor at that point, so they kind of know that I have that experience of what they're going through on the floor, and I think it makes my advice maybe a little more credible. It also gives me the knowledge of what they're going through on the floor on a day-to-day basis, so I can put myself in their shoes and know what they're experiencing. I've also been known to just jump in and help when I need to. For an example, this morning, one of our providers called out sick, and I was jumping in trying to freeze their schedule so that we could get the patients rescheduled or get a new provider to move them to. So I do think it's really helpful in a lot of different ways. A normal day for me as a Director of Operations usually starts out with email, catching up on my email. It's kind of the first thing I do in the morning. Make sure there's no fires that I need to put out immediately first thing. The second thing is probably prepping for some meetings. We do a lot of collaborative work here at CHAS, meaning I get to work with my teams, whether it's the clinic team, my Director of Operations team, my leadership team. We do a lot of collaboration, so preparing for those meetings that are probably going to help with strategic planning, might be financial planning for the clinics or service line, might be a meeting with my direct teams, kind of really working on what were clinic-specific items. I allow myself some time to plan for the meetings for the following day, so a lot of it is putting out fires as they come up and attending meetings and preparing for meetings. The skills that I use on a daily basis absolutely have to have good communication skills. The way you are talking to employees, the way you're talking to patients, family members, whoever you're talking to, and it might not always be verbal communication. It might be email communication. We use a lot of Teams messaging or instant messaging to communicate with other staff members. So really, really good communication skills. And I would say people skills is really important as well. You know, you might be trying to de-escalate an angry patient or work with a staff member who's having a hard time. And that's definitely something I had to learn in my career developed as my leadership skills developed. It's definitely, those are probably the two that I use the most. Time management, I don't always have a schedule of what things I need to do on a daily basis. I have to work that myself, so I'm prepared for my meetings or my presentations that I'm going to be providing. The demand for positions in healthcare is always high, and I think that's no matter where you go, which is kind of one of the appeals of being in healthcare, is that you can go wherever and always know that there's demand for a job here, or a job in healthcare. At CHAS, the opportunity for growth specifically, I personally feel has been great. I have seen my own path growing through CHAS, but I've also been a part of a lot of other people's path. I think that's one of the most satisfying things in my position, is that I've been able to help people see their own growth path through CHAS and actually come up and be supervisors, be somebody in quality improvement, and other areas that they were interested in, our workforce development department. There's a lot of opportunities for growth in CHAS. There are a lot of opportunities at CHAS for advancement with our apprenticeship programs. We have, you can come in fresh out of high school and apply for one of our medical, dental, pharmacy apprenticeship programs, and you will get paid to learn. You'll get paid to get on-the-job experience, and you'll come out of the program with a certification in those fields. Another opportunity is our tuition reimbursement program, or our tuition assistance program. So I actually was a very fortunate beneficiary of the tuition assistance program. and CHAS actually paid for me to get my bachelor's degree in business administration. So there are a lot of opportunities for advancement, assistance at CHAS Health.